I'm excited to announce that we recently are moving towards launching a Sublocade, what I lovingly call Sublocade Fast Pass pilot, like Disneyland, which means that there are 4 prescribers who get immediate automatic approval for anyone that they prescribe Sublocade for.
At this month's meeting, Julia Jackson from Jackson Care Connect gave several updates about current programs to educate the community and treat people for substance use disorder, including fentanyl awareness efforts, the adoption of Sublocade as a new form of medication-assisted treatment, the Mental Health Minute public awareness campaign by KOBI, and more.
First off, I thought it would be helpful to share the Unite Us newsletter. As you can see, I'm just kind of scrolling right now through it. One of the things I like about it is the new organizations on Unite Us in the last quarter. There's also helpful contact information. There's tips and tricks, kind of who your contact is for the platform. I wanted to highlight that because Unite Us was a huge component of the opioid summit and what we talked about and being helpful. Sharing some other pieces, just kind of updates on pathways that we're making to increase peer services. We've engaged with Reclaiming Lives to develop a standing contract of support and formally add them to the network of providers, which I think is really acknowledging the impact that our community-based organizations have just as much as our valued clinical and traditionally clinical providers. Another topic that I do think is relevant for the group is that, Sublocade has been brought up as a medication, a form of medication-assisted treatment that there is definitely a difficult prior authorization process right now with Care Oregon, and I've been advocating for a long time. I've been here 2 years, and I can tell you that Sublocade has been a part of the conversation for a while, and I've been a thorn in everyone's side. And so I'm excited to announce that we recently are moving towards launching a Sublocade, what I lovingly call Sublocade Fast Pass pilot, like Disneyland, which means that there are 4 prescribers who get immediate automatic approval for anyone that they prescribe Sublocade for a pilot period, which is September 1st until December 31st, 2023. So over a year, during which time we're really going to look at outcomes and overall cost of care and the efficacy of Sublocade versus other forms of MAT. And the 4 pilot prescribers are Carrie Hecox with Oasis, Nat Vondell with La Clinica, Dan Weiner with Road Community Health, and Dottie Oliveira with ARC. We've been doing a round of meetings with the school districts in Jackson County, and SUD support has definitely been a focus of conversation. Interestingly enough, what we're hearing is that there are plenty of services that are available in terms of the actual supply, but understanding how to navigate them, increasing awareness for students, for staff, for families, that's really the area of focus right now. So if anyone is interested in the school project in particular, so collaborating with schools to increase SUD support, if you're interested in that, I think there's some work that can be done and some discussions to have, and I'm hoping that there are some folks who want to collaborate on that. We have been sponsoring through matched funding a public awareness campaign for the past year or so called the Mental Health Minute. I don't know if folks have seen that. It's a Kobe Mental Health Minute, and it's been really powerful. Like it's a powerful media outlet, and it links specifically to what we talked about in the Opioid Summit Action Plan. And so it's already there. So what we're doing is we're repurposing it, and we're going to have a far heavier SUD focus, SUD and co-occurring focus to it. But for example, in July, we partnered with Columbia Care to highlight peer support. In August, We partnered with Boulder Care to highlight medication-assisted treatment via telehealth, that is an option for folks. And September is going to air soon, and that was with ARC on connections and recovery. I actually just saw it today, and it looked fantastic. And then October is slated to highlight the recovery connections, hopefully with specific focus on Latinx community, and that's going to be through Reclaiming Lives. We just touched base with Stephanie to get partnership there to highlight them. So if you would like to be a part of the Mental Health Minute, for your program or services to be highlighted, please reach out to me in email.